Today, we're tackling a feeling that can be just deeply confusing and honestly pretty frightening. It's that sudden loss of balance or that terrifying sensation that the whole world has started spinning. We are talking about dizziness and its very specific cousin, vertigo. You know the feeling, right? That sudden, disorienting moment where you're not sure which way is up. If you've ever felt that, you're definitely not alone. And really, understanding what's actually happening inside your body is the very first step toward getting back on solid ground. All right, so let's start by trying to pin down a word that we all use, but one that can mean a whole lot of different things. What exactly is dizziness? Well, here's the thing. Dizziness isn't just one feeling. It's a huge umbrella term. It covers everything from feeling a little lightheaded to feeling like you might faint to just being unsteady. And that's exactly why it can be so tough to explain to a doctor. The word itself is a total catch-all. So to really get to the bottom of this, we have to make a super critical distinction. We've got to separate that general, vague feeling of dizziness from its much more specific and often way more intense cousin, vertigo. And here's the absolute crucial point. Dizziness is feeling off. Vertigo is feeling motion. If you feel like you are spinning, or that the room around you is spinning, when, everything is perfectly still, that is the signature of true vertigo. It's a false alarm, a fake signal of movement. So why does this even happen? Well, vertigo isn't just some random sensation. It's the main signal that something is off with your vestibular system. Think of that as this amazing, sophisticated network in your inner ear and brain that basically acts as your body's gyroscope. When that system gets disturbed, your brain gets faulty motion signals. Okay, so if you're experiencing true vertigo, what's actually causing that disturbance in your personal balance system? Let's take a look at the most common culprits. Get ready for this number because it's a big one. According to the research, up to 42%, nearly half of all vertigo cases can be traced back to one single very specific condition. And here it is. It's called benign paroxysmal positional vertigo, or BPPV for short. And what causes it is actually pretty fascinating. You've got these tiny little calcium carbonate crystals, think of them like little ear rocks, and sometimes they break loose. So when you move your head, these rogue crystals drift into your balance canals and send these chaotic false signals to your brain, which is what triggers that intense spinning sensation. Now, beyond BPPV, you've got two other common causes. There's Meniere's disease, where the vertigo often comes with hearing loss or ringing in the ears. And then there's vestibular neuritis, which can hit you with sudden, constant vertigo for days, a lot of times after you've had a virus. Just notice how different the symptoms and the treatments are for each one. But you know what? It's not always about the inner ear. When we zoom out and look at the bigger picture of dizziness, especially in older adults, something else really stands out. One study found that for patients over 65, an adverse drug reaction was the actual culprit in nearly a quarter of all cases. That's a powerful reminder to always consider medications as a major factor. Okay, so we know what can cause it, but how do we fix it? Well, here's the great news. For the most common type of vertigo, the treatment is incredibly effective, and it's probably not what you're expecting. This is called the Epley maneuver, and for BPPV, it's a total game changer. It's not a drug, it's a physical therapy. A trained professional, like a physical therapist or a doctor, guides your head through a very specific series of movements. And the goal is simple. It's to use gravity to physically guide those loose crystals out of the sensitive canal and back to a part of the inner ear where they won't cause any more trouble. But what about medications? The ones called vestibular suppressants? It seems like the logical thing to do, right? But the research shows a really crucial, kind of counterintuitive warning. These drugs can actually reduce or slow down your brain's natural ability to fix the problem on its own. So here's the bottom line, the key takeaway. Well, those medications can absolutely help you get through severe symptoms for maybe a day or two. Using them long-term is a real problem. They stop your brain from doing the essential work of recalibrating itself. It's a process called vestibular compensation. Basically, by masking the symptoms, they can actually make your recovery take a lot longer. Now, before we wrap up, we have to cover what is absolutely the most important part of this entire conversation. And that's knowing when vertigo isn't just a nuisance, but a sign of a true medical emergency. So listen up. If your vertigo or dizziness comes on suddenly, and it comes with any of these other symptoms, numbness, tingling, or weakness, any visual changes, or any confusion or difficulty speaking, you have to treat it as a medical emergency. Call 911 immediately. That combination of symptoms could be a sign of a stroke. So now you know. You can tell the difference between that vague, dizzy feeling and true spinning vertigo. You know the most common cause is often just a simple mechanical issue, those loose crystals in your ear. And most importantly, you know the red flags. So the question is, what will you do with that knowledge? Being able to accurately describe your symptoms, that is the key that unlocks the right diagnosis and the right treatment and helps you get back on solid ground. Thanks for joining us.